Hello and welcome. My name is Lisa Eggert, and I am a Senior Account Manager at Delta Dental. I work with the retirement system to oversee the dental plan and handle anything that relates to dental benefits. My goal in the presentation today is to help you better understand your dental plan so you can maximize your benefits within the plan. We will review the plan changes for 2024, key terms, your 2024 cost share information, and I will share how the plan works, including provider choices, so you will be able to maximize your dental dollars. Lastly, I will review available resources for your dental plan, including how to contact Delta Dental. Our first topic is plan updates. The retirement system has reviewed the dental plan and is excited to announce that there are enhancements to the dental plan that will take effect January 1, 2024. There are two enhancements to the dental plan in the upcoming plan year. The first enhancement pertains to the occlusal guard benefit. An occlusal guard is a clear appliance worn over the teeth to protect them from grinding and/or clenching of the teeth. The dental plan currently covers occlusal guards once in a lifetime. Effective January 1, 2024, occlusal guards will be covered once every 5 years. Occlusal guards are covered under the basic services, and the cost share will remain the same for the upcoming plan year. Cost share for basic services will be covered later in this presentation. The second benefit that is receiving an enhancement is the benefit for composite fillings. Composite fillings are also described as white fillings. Currently, the plan does not pay for posterior composite fillings, which are also referred to as white fillings on back teeth, and posterior composite fillings are considered an optional treatment. This means that if you select to have a posterior composite done, the plan will only pay the amount that it would pay for an amalgam or silver filling, and the member will be responsible to pay the cost difference between the two services. Effective January 1, 2024, posterior composites will be covered under the dental plan. Our second topic is key terms. These terms are important because the topics will be discussed throughout our presentation. So before we get to the specifics of your dental plan, I believe that it would be helpful to review these key terms. Coinsurance is a fixed percentage of the cost you share with your retirement system. The coinsurance changes based on the type of service that is being provided. Deductible is the amount you pay each year before your retirement system begins to pay. It remains the same in 2024. Annual maximum is the most that your retirement system dental plan will pay in a calendar year for diagnostic and preventive services, basic services, and major services benefits. Orthodontic lifetime maximum is the most that your retirement system dental plan will pay the entire time you're enrolled in the plan for orthodontic services. Coordination of benefits is the way in which claims are paid when there is more than one dental benefits plan. Your retirement system dental plan uses the carve-out method to process COB claims. Visit deltadentalmi.com/MPSERS or contact Delta Dental for more information if you have more than one dental plan. The next topic we will cover is provider options. The type of provider you seek services from determines how the claim will pay, so it is important to understand the differences between the types of providers. With the retirement system dental plan, you have the freedom to choose any dentist. If you consider all of the dentists that are available, you can place them into 3 buckets: Delta Dental PPO, Delta Dental Premier, and non-participating. The retirement system dental plan is designed to offer the maximum benefit with the lowest out-of-pocket expense when you use a Delta Dental PPO dentist. You will save the most money when you seek services from a Delta Dental PPO provider, because all claims, regardless of the type of provider, are reimbursed at the Delta Dental PPO approved amount which is the reimbursement rate that a Delta Dental PPO provider has agreed to accept. You will likely pay more when you use a Delta Dental Premier or non-participating dentist because their fees are higher than the Delta Dental PPO approved amount. Let's review each of these provider types. Delta Dental PPO providers are the first type of provider that we will review. When a Delta Dental PPO provider joins our network, he or she agrees to accept the Delta Dental PPO approved amount as payment in full. That means that you are only responsible for your coinsurance. In addition, as a participating provider, the Delta Dental PPO provider cannot charge you the difference between the submitted amount, which is the amount they would normally receive for services, and the Delta Dental PPO approved amount, or in other words, they are not allowed to balance bill you. As part of participating in our network, we pay the participating provider directly. The retirement system has designed the dental plan to pay the highest level of benefit when you seek services from a Delta Dental PPO provider due to the lower coinsurance amounts. As an additional advantage in using a Delta Dental PPO provider, there is no deductible for any type of service when going to a Delta Dental PPO provider. Although Delta Dental Premier providers also participate with Delta Dental and offer discounts off their submitted fees, they do not accept the lower Delta Dental PPO approved amounts. So when you seek services from a Delta Dental Premier provider, you pay your coinsurance plus the difference between the Delta Dental PPO and Delta Dental Premier approved amounts. Because the Delta Dental Premier provider is a participating provider, there is no balance billing between the difference of the Delta Dental Premier approved amount and the submitted amount. Once again, as noted with the Delta Dental PPO providers, as a participating provider, we will reimburse the Delta Dental Premier provider directly. Lastly, the deductible applies to basic and major services when seeking services from a Delta Dental Premier provider. The last type of provider is a non-participating provider, which means that the non-participating provider does not have a contract with Delta Dental and is not required to offer a discount or follow any of the guidelines that we set for our participating providers. When you go to a non-participating provider, you are ultimately responsible for the dentist's submitted amount. A non-participating provider will likely cost you the most money because you pay your coinsurance plus any additional cost up to the provider's charge, which means a non-participating provider can balance bill. In addition, the deductible applies to basic and major services when seeking services from a non-participating provider. When you go to a non-participating provider, you will likely be required to pay for the entire cost of the service upfront. Since a non-participating provider is not required to submit a claim for you, you should ask whether the office will submit the claim for you. To receive your reimbursement from the plan, we need to receive the claim. So if the non-participating provider will not submit the claim, you will need to do it. As a side note, within our participating networks, Delta Dental PPO and Delta Dental Premier, the providers are contractually required to submit claims for their patients. This slide illustrates a quick visual of the 3 different types of providers. As you can see, within our participating networks, Delta Dental PPO and Delta Dental Premier, the number of locations and the number of unique dentists continues to grow nationwide. As a recap, with Delta Dental PPO providers, you only pay your coinsurance. There is no balance billing, no deductible on any of the services, and you receive the highest benefit level. With Delta Dental Premier providers, you pay your coinsurance and the difference between Delta Dental PPO and Delta Dental Premier approved amounts. There is no balance billing, and you have a deductible that applies to basic and major services. And lastly, with non-participating providers, you pay your coinsurance and any additional amounts up to the provider's charge. You can be balance billed by the provider, and you have a deductible that applies to basic and major services. Since the type of provider that you choose determines how the claim will be paid, it is important to have a good understanding of the types of providers. I've included some additional notes about providers that you may find helpful. Your dental plan allows for access to participating providers across the United States. So no matter where you live or travel, you can seek dental services from Delta Dental participating providers. If you are out of state, it is important to let your provider know that claims need to be submitted to Delta Dental of Michigan to process and pay, since that is where you have coverage. All providers outside of the United States are considered non-participating providers, but out-of-country claims can be submitted for reimbursement. If you are searching our provider networks, you may notice that sometimes a provider participates with both the Delta Dental PPO and the Delta Dental Premier Network. If this is the case, the claim will automatically be processed using the Delta Dental PPO network status, higher benefit, deeper discounts, when a claim is submitted. Please note that a provider may have different network status based on office location, so be sure to confirm with the treating office. Feel free to provide a copy of the coverage overview flyer to your provider. Lastly, an office could have both Delta Dental Premier and Delta Dental PPO providers. If you want to see a Delta Dental PPO provider because you will receive a higher level of benefit and deeper discount, let the provider office know that you want to see only the PPO provider based on how your plan pays out benefits. Participating status is based on the provider and location, not by the office. The next topic is your 2024 cost share. As noted on this slide, your cost share is a percentage of the approved amount, coinsurance, and any applicable deductible. You may recall that I mentioned earlier that your coinsurance changes based on the type of service that you are having completed. The coinsurance is also affected by the type of provider that you are seeing. You will notice two columns on this slide. The first is the Delta Dental PPO dentist, and the second is the Delta Dental Premier and non-participating dentist. As you can see within the diagnostic and preventive services category, there is a lower coinsurance when you seek services from a Delta Dental PPO provider, which means you will have lower out-of-pocket cost. If you are having cleanings and exams done by a Delta Dental PPO provider, you will only have a 5% coinsurance. If you go to a Delta Dental Premier or non-participating provider, the coinsurance is 10%. As a side note, cleanings and exams are covered twice within a calendar year, which means that any time between January 1 and December 31st, you can have 2 cleanings and 2 exams completed. If you go to a Delta Dental PPO provider for x-rays, the coinsurance is 5%. If x-rays are done by a Delta Dental Premier or non-participating provider, you will have a 25% coinsurance. The next category of service is basic services. This is really where the bulk of your dental procedures fall. Within this category, you will have minor restorative services, which are fillings, major restorative services, which are crowns, periodontic services, which are anything that has to do with your gums, endodontic services, which are root canals, oral surgery services, and relines and repairs to existing dentures and implants. As you can see within the basic services category, fillings have a lower coinsurance when you go to a Delta Dental PPO provider. The coinsurance is 20%. If you go to a Delta Dental Premier or non-participating provider for fillings, the coinsurance is 25%. All of the other services within this category have a 25% coinsurance for Delta Dental PPO, Delta Dental Premier, and non-participating providers. Even though all providers have a 25% coinsurance, you will save the most money when you go to a Delta Dental PPO provider. Later in this presentation, we will walk through a payment example so you can see how a claim is processed based on the type of provider. You will also note that within the basic services category, there is a deductible for services that are performed by a Delta Dental Premier or non-participating provider. This deductible is also applied in the major services category, which is the last category of service on this slide. Major services include prosthodontic services, which are anything to do with replacing missing natural teeth or adding fake teeth, bridges, dentures, and implants. Within this category, the coinsurance is 50% for all types of providers: Delta Dental PPO, Delta Dental Premier, and non-participating. Once again, even though all providers have the same coinsurance amount, you will save the most money and have the lowest out-of-pocket expense if you go to a Delta Dental PPO provider. The Dental Coverage Overview flyer has more detailed information on the dental benefit categories. This flyer can be found on the Retirement Plan site located at deltadentalmi.com/MPSERS. As noted on an earlier slide, the annual maximum is the most that your retirement system dental plan will pay in a calendar year for diagnostic and preventative services, basic services, and major services, which are the services we discussed on the previous page. So from January 1 to December 31st, every time the plan makes a payment on a service, that amount is deducted from the $1,100. Once the plan has paid $1,100 for services, your annual maximum will be maxed out and no additional services will be paid. You can continue to get services done, but you will pay out of pocket for the cost of those services. It is important to note that if you are seeking services from a Delta Dental PPO or Delta Dental Premier provider, you will continue to receive the discounted amount based on the type of provider, even if you are over your annual maximum or have a non-covered service. It is important to look at your explanation of benefits after a claim has been paid to make sure that the amount you paid your provider office for services matches the amount that the EOB says is patient payment. If these amounts are different, you can contact Delta Dental Customer Service, and we will reach out to the office to resolve the discrepancy. Each person covered under your plan has their own annual maximum of $1,100 to use throughout the year. At the end of the year, whether you have used all, some, or none of your $1,100 annual maximum, the slate is wiped clean, and everyone starts with a brand new annual maximum on January 1st of each new year. The orthodontic maximum is different because it is a lifetime maximum. This means that the most the retirement system dental plan will pay for the orthodontic services during the entire time you're enrolled in the retirement system plan is $1,200. So every time an orthodontic service payment is made, that amount is deducted from the $1,200 ortho lifetime maximum. And once the plan has paid $1,200 for orthodontic treatment, there will be no more payment made for orthodontic services. As a reminder, orthodontic services are covered for dependents to age 19. There is also an annual deductible for this dental plan. The deductible is the amount you pay each year before your retirement system begins to pay. The deductible only applies to basic and major services when you go to a Delta Dental Premier or non-participating provider. There is no deductible for diagnostic and preventive services for all provider types, and there is no deductible if you seek services from a Delta Dental PPO provider. The deductible is $50 per person per calendar year. Lastly, the Retirement Systems Dental Plan has a carve-out clause for coordination of benefits when the plan pays as secondary. This carve-out clause affects the way in which claims are paid when there is more than one dental benefits plan. For additional information, please review the How Coordination of Benefit Works flyer at deltadentalmi.com/MPSERS. In this first example, we have a major restorative service, or in other words, a crown. As a reminder, When you have a basic and/or major service done by a Delta Dental Premier or non-participating provider, you will have a deductible, so you will see that in the example shown here. As we begin, you will notice on the left side of the page that we have the 3 types of providers that we previously discussed. The first provider type is the Delta Dental PPO dentist. As you can see, this Delta Dental PPO dentist charged $1,320 for this crown, but because he or she participates in the Delta Dental PPO network, he or she agrees to accept $875 for the service. This is the PPO approved amount and the amount that will be the allowed amount on all claims. Because this provider participates in the Delta Dental PPO network, he or she cannot balance bill you the difference between the $1,320 charge and the $875 approved amount. There is no balance billing. Since this crown is being done by a Delta Dental PPO provider, there is no deductible. The coinsurance, which is 25% for major restorative services, is applied to the Delta Dental PPO approved amount, so we have 25% of $875, which equals $218.75. Since the Delta Dental PPO provider has agreed to accept the Delta Dental PPO approved amount as payment in full, there is no additional cost when you seek services from a Delta Dental PPO provider. So your out-of-pocket cost for a Delta Dental PPO provider in this example is $218.75. If we move to the next row, we will see the Delta Dental Premier dentist. In this case, the Delta Dental Premier dentist also charged $1,320. But because they participate in the Delta Dental Premier network, the Delta Dental Premier approved amount is $1,050. However, the plan will only reimburse the Delta Dental PPO approved amount on all claims, which is $875. Because this provider participates in the Delta Dental Premier network, he or she cannot balance bill you the difference between the $1,320 charge and the $1,050 Delta Dental Premier approved amount. There is no balance billing. So if we look at the member cost share, we will see that because this is a Delta Dental Premier provider, there is a deductible of $50. Moving to the coinsurance, we apply the 25% coinsurance to the Delta Dental PPO approved amount, which is the same as the allowed amount. Because a deductible of $50 was paid, we deduct $50 from the Delta Dental PPO approved amount first. So $875 minus $50 is $825. So 25% of $825 is $206.25 of coinsurance. The additional cost for this Delta Dental Premier provider is the difference between the Delta Dental Premier approved amount of $1,050 and the Delta Dental PPO approved amount of $875 that is paid on this claim. So the additional cost is $175. If you total up the member cost share, which includes deductible, coinsurance, and additional cost, the out-of-pocket for this Delta Dental Premier example is $431.25. The last row is a non-participating provider. In this case, the non-participating provider also charged $1,320. But it is important to note that when members go to a non-participating provider, they are ultimately responsible for the charge. In this case, the non-participating approved amount is $1,320, since that is the amount the non-participating provider will end up with at the end of the day. However, the plan will only reimburse the Delta Dental PPO approved amount on all claims, which is $875. So, if we look at the member cost share, we will see that because this is a basic service done by a non-participating provider, there is a deductible of $50. Moving to the coinsurance, we apply the 25% coinsurance to the Delta Dental PPO approved amount, but because the deductible of $50 was paid, we deduct $50 from the Delta Dental PPO approved amount first, so $875 minus $50 is $825. So 25% of $825 is $206.25 of coinsurance. The additional cost for this non-participating provider is the difference between the non-participating approved amount of $1,320 and the Delta Dental PPO approved amount of $875 that is paid on this claim. The additional cost is $445. If you total up the member cost share, which includes deductible, coinsurance, and additional cost of the out-of-pocket for this non-participating example, is $701.25. As you can see, even though the coinsurance is the same at 25% for all provider types, the type of provider that you choose determines how the claim will pay and ultimately your out-of-pocket cost. You will save the most money in the retirement system plan if you seek services from a Delta Dental PPO provider. In this next example, we have a diagnostic and preventive service, or in other words, a cleaning. Because this is a diagnostic and preventive service, there is no deductible for any type of provider. Once again, you will notice on the left side of the page that we have the three types of providers that we previously discussed. We will look at Delta Dental PPO dentist first. As you can see, this Delta Dental PPO dentist charged $106 for the cleaning, but because he or she participates in the Delta Dental PPO network, he or she agrees to accept $70 for the service. This is the PPO approved amount and the amount that will be allowed on all claims. Because this provider participates in the Delta Dental PPO network, he or she cannot balance bill you the difference between the $106 charge and the $70 approved amount. There is no balance billing. As a reminder, there is no deductible. The coinsurance, which is 5% for diagnostic and preventive, is applied to the Delta Dental PPO allowed amount, which is the amount that will be used to calculate payment on all claims. Therefore, 5% of $70 equals $3.50. Since the Delta Dental PPO provider has agreed to accept Delta Dental PPO approved amount as payment in full, there is no additional cost when you seek services from a Delta Dental PPO provider. So your out-of-pocket cost for a Delta Dental PPO provider in this example is $3.50. If we move to the next row, we will see the Delta Dental Premier Dentist. In this case, the Delta Dental Premier Dentist also charged $106, but because they participate in the Delta Dental Premier network, the Delta Dental Premier approved amount is $84. However, the plan will only reimburse the Delta Dental PPO approved amount of $70 on all claims, which is shown in the allowed amount column. Because this provider participates in the Delta Dental Premier network, he or she cannot balance bill you the difference between the $106 charge and the $84 Delta Dental Premier approved amount. There is no balance billing. So as we look at the member cost share, we will see that there is no deductible because this is a diagnostic and preventive service. Moving to coinsurance, we apply the 10% coinsurance to the allowed amount, so 10% of $70 is $7 of coinsurance. The additional cost for this Delta Dental Premier provider is the difference between the Delta Dental Premier approved amount of $84 and the Delta Dental PPO approved amount of $70 that is paid on this claim. So the additional cost is $14. If you total up the member cost share for this example, it includes only coinsurance and the additional cost because the deductible is waived for preventive services. The out-of-pocket for this Delta Dental Premier example is $21. The last row is a non-participating provider. In this case, the non-participating provider also charged $106. But once again, it is important to know that when members go to a non-participating provider, they are ultimately responsible for the entire charge. So in this case, the non-participating approved amount is $106 because that is the amount the non-participating provider will end up with at the end of the day. However, the plan will only reimburse the Delta Dental PPO approved amount of $70 on all claims, which is shown in the allowed amount column. So as we look at the member cost share, we will see that there is no deductible since this is a diagnostic and preventive service. Moving to coinsurance, we apply the 10% coinsurance to the allowed amount, so 10% of $70 is $7 of coinsurance. The additional cost for this non-participating provider is the difference between the non-participating approved amount of $106 and the Delta Dental PPO approved amount of $70 that is paid on this claim. So the additional cost is $36. If you total up the member cost share for this example, it includes only coinsurance and the additional cost because the deductible is waived for preventive services. The out-of-pocket for this non-participating example is $43. So in this example, we saw that members receive a higher level of benefit when seeking services from a Delta Dental PPO provider because there was a 5% coinsurance versus the 10% coinsurance for Delta Dental Premier and non-participating providers. So once again, the type of provider that you choose determines how the claim will pay and ultimately your out-of-pocket cost. You will save the most money in the retirement system plan if you seek services from a Delta Dental PPO provider. I am often asked if there is a way to receive an estimate for services that are needed. The answer is yes, a pretreatment estimate. When a pretreatment estimate is submitted to Delta Dental by your provider, it will provide information about how the dental plan will cover the service and your out-of-pocket cost. This information is helpful as it may lead to further discussion of treatment options with your provider. Be sure to let your provider know that you want the pre-estimate sent to Delta Dental. When this pre-treatment estimate is sent to Delta Dental, the estimate runs through our system as if it were being processed and paid and reviews current annual maximum available, time limitations for services, and whether the service is covered by your retirement system dental plan. You will know that this has been completed because a copy of the estimate will be provided to both you and your provider. Please remember that the pre-treatment estimate is subject to the amount of annual maximum available at the point in time that we receive the request. If you have additional services done after the estimate, it may affect the payment amounts for the procedure that was sent for the pre-estimate. The last topic we will cover is helpful resources. To provide materials and information that are specific to the Retirement System Dental Plan, we have a designated extranet site for the retirement system. The link for this site is located on the Michigan Office of Retirement Services website, or can be accessed directly at www.deltadentalmi.com/MPSERS. On this site, you will be able to access specific information about your retirement system dental plan, access written plan documentation, view this presentation, search the dentist directory for a provider, and link to the member portal. Where the extranet site that we discussed on the previous page covers details about the plan, the member portal allows you to access your specific dental plan information once you have created an account. Once you have logged in to the member portal, you will be able to view members covered on your plan, find an in-network dentist, see information on common procedures, view and print specific explanation of benefits, check your annual maximum used to date, access and print an online ID card, And lastly, view the status of all claims. The Member Portal website can be viewed on all devices. As a note, the Member Portal replaced the Consumer Toolkit in early 2021. You can either use your existing Consumer Toolkit credentials to log in or click Sign Up if you do not have login credentials. The best way to find a provider is to access the provider directories online, as this is the most up-to-date information available. If you are not comfortable going online, you always have the option to call customer service and request that they send you a listing of providers near a certain address or zip code. The next couple of slides will provide information on how to do a dentist search online. You can access the dentist search feature on the Delta Dental corporate website or on the extranet site that is specific to the retirement system. The Find a Delta Dental Participating Dentist flyer at www.deltadentalmi.com/MPSERS provides step-by-step instructions on how to search for a provider. Once you have made the selection to find a dentist and search for a Delta Dental PPO and Delta Dental Premier provider, you will see this screen as shown above. In the first box labeled Specialty, you can search for a specific specialty or search any specialty, which will include all results from all provider types. In the second drop-down box, you can choose the network that you want to search. I would recommend that you search the Delta Dental PPO network first, as providers in that network will save you the most money. But you can also choose to search the Delta Dental Premier network. You can also include a dentist's last name if it is available, or leave it blank. If you select Y for search by current location, the search will use your current location. If you select N for search by current location, an additional field will pop up for zip code, city, or address. Once you have input the information, select the green box labeled Find Dentist. As you select Find Dentist, a new screen will appear with your search results. The search results will display the closest provider to your location, if you provided a physical address. You will be able to scroll through the provider results. In addition, once you have the initial results, you will have more options to change the search or add additional criteria. You will be able to change the specialty and network in the first two boxes. You can also set the distance radius and search for providers from a specific address. Providing an address will give you the best information, as it will list the providers closest to your location moving outwards. If you select the down arrow for more options, you will have access to additional fields to add a provider last name, office name, and select specific criteria about hours, language, gender, and whether the office is accepting new patients. If you want to save your results, you can select the Add All to My List checkbox and select specific providers that you want to save. Once you have selected the results that you want to save, click on the down arrow next to My List, which is shown on the top right side of the page. Within this selection, you can choose PDF, print, or email. Remember, if you see that a provider participates in both Delta Dental PPO and Delta Dental Premier, the claim will automatically process and pay using the Delta Dental PPO network status, which will save you the most money. Delta Dental has a smartphone app that is available for Apple iOS and Android users. To access the app, you need to create a member account. If you already created a Member Portal account, the username and password is the same for the phone app. This phone app will allow you to access the cost estimator, view benefits, find a dentist, view claims, and view your mobile ID card. As a reminder, because the Member Portal has been designed to be viewed on all devices, the Member Portal features are available at your fingertips as well. Did you know that there are more than 120 signs and symptoms of non-dental disease that can be identified in an oral exam? That is why preventive care is so important. During a routine visit, if certain signs are detected, a dentist can urge his or her patient to seek medical attention to help better manage their oral health and overall health. Some additional behaviors that will improve your oral health are brush at least twice a day, floss regularly, avoid use of tobacco and limit alcohol, drink fluoridated water, and visit your dentist regularly. Remember, if you notice any changes or abnormalities within your mouth, be sure to talk to your dentist about your concerns. More than 90% of common diseases have oral symptoms and can be detected in the dental chair. Lastly, you can contact the Delta Dental Customer Service Department toll-free at 800-345-8756. Our advisors are available 8:30 a.m. to 8 p.m. Eastern Standard Time, Monday through Friday. We also have an automated system that is available 24 hours a day, 7 days a week. The automated system provides benefit, claims, and eligibility information, the Delta Dental mailing address, and names of Delta Dental PPO and Delta Dental Premier dentists near you. As a reminder, you can also access plan information and additional resources on the extranet site for the retirement system at www.deltadentalmi.com/MPSERS. Thank you for taking the time to review the information about your dental plan. I hope that you found this information helpful. If you have additional questions after viewing this presentation, please reach out to Delta Dental Customer Service using the information provided on the previous slide. Thank you for your time and attention during the presentation today. Have a great rest of your day.